Do you like food? Well, food comes from farms, and farms need your help. So, if you help farms, it's kind of like you're feeding yourself. And let's be honest, you're grown up now, you should have learned how to do that years ago.
The problem with the healthcare system is that people aren't seeing any long-term benefits from the medical attention they are receiving because their lifestyle isn't changing and their diet isn't changing. We think a solution to this problem would be to make whole foods cost the same as processed junk foods.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
Lots of ways we have of avoiding and numbing and bypassing pain, but the point of all of this is to deal with the cause of the problem and talk about diet, stress management, which are really these spiritual practices, moderate exercise, smoking cessation, support groups and community, which I'll talk more about, and some vitamins and supplements. And it's not a diet. You know, when most people think about the diet I recommend, they think it's a really strict diet. For reversing disease, that's what it takes. But if you're just trying to be healthy, you have a spectrum of choices. And to the degree that you can move in a healthy direction, you're going to live longer, you're going to feel better, you're going to lose weight, and so on. And in our studies, what we've been able to do is to use very expensive, high-tech, state-of-the-art measures to prove how powerful these very simple and low-tech and low-cost and in many ways ancient interventions can be. Because we doctors do what we get paid to do, and we get trained to do what we get paid to do. So if we change insurance, then we change medical practice and medical education. Insurance will cover the bypass, it'll cover the angioplasty, but won't until recently cover diet and lifestyle. So we began through our nonprofit institute training hospitals around the country, and we found that most people could avoid surgery. And not only was it medically effective, it was also cost effective, and the insurance companies found that they began to save almost $30,000 a patient. And Medicare is now in the middle of doing a demonstration project where they're paying for 1,800 people to go through the program in the sites that we've trained.
I think that there's been a very clear decline in the value of how we eat.
I think the problem is cost and not enough time to educate people on it.
Maybe you want to eat better, but you just don't even know how.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
The health of our nation depends on whole foods. By purchasing from whole foods farmers, not only are we investing in our nation's health, but also lessening our overall health costs that are associated with poor dieting. This poor dieting is costing millions of Americans thousands of dollars in medical expenses.
You can eat locally and you can support these people, and right now it's expensive to do, but if more people are going to buy that food, it can become where everybody can eat locally.